welcome back to my channel. My name is Patricia St. Louis. I am a registered nurse and I'm also a licensed insurance agent. And I basically educate my clients on Medicare and Obamacare. I also help my clients with life insurance as well. But I specialize in educating my clients understand Medicare and understand Obamacare as well. First, I would love to give a shout out to Roger Williams. This video idea came from one of his comments. So he said, could you talk about the cost of usage like max out of pocket and its definitions, etc. So thank you, Roger, for leaving that comment. This video is definitely dedicated to Roger. So in this video, I'm going to help you guys understand your policy. What is max out of pocket? What is coinsurance? What's a co-payment? Things like that, so that way you guys really understand your policies when you're reading your policies. So yeah, like I said, my name is Patricia St. Louis. I'm a registered nurse and a licensed insurance agent. If you guys need my assistance, this is my number. Please feel more than happy to call me. I will help you and your questions with insurance, or if you need to be enrolled in an insurance plan. And my services are 100% free. So we're going to kind of focus on Obamacare, and we're going to talk about some of the definitions that's associated with insurance plans. So let's get started. All right, so everyone learns a little different. I like to write things down. Some people like to see things, some people like to write things down. So what are we going to talk about today? Of course, we're going to talk about the Affordable Care Act, also known as Obamacare. We're going to go over the terms of what is coinsurance, what's copay, what's cost sharing, what's the deductible, what's the enrollment period, what are the essential health benefits, what's in-network, also known as HMO, what about PPO, the premium, the referral, subsidy, and the max out-of-pocket costs. All right, so the first definition we're going to go over is coinsurance. So what is coinsurance? So coinsurance is the percentage that you pay and then the insurance will pay the rest. So for example, say your coinsurance is 20%. Say the bill is $100. So you're responsible to pay $20 and the insurance company will pay the 80%, which is $80. So coinsurance is just the percent amount that you're responsible to pay for that service. So what about copay or your co-payment? So copay is a little different from coinsurance. So your copay is the fixed amount that you're responsible to pay. Say, for example, your copay to see your doctor may be $35 a visit. So that means you are going to pay $35 every time you go see your doctor. It's a fixed amount, it's not a percentage. So your copay could be $10, $20, $35, whatever it is, it's a fixed amount. And that's what you pay when you go see your doctor. So the next definition on the list is cost sharing. So what does cost sharing mean? So basically there are 4 levels with the Obamacare, right? So there's 4 different levels of insurance. The levels are bronze, silver, gold, and platinum. So the cost sharing helps with the silver plan. So that basically means that the federal government would help with the cost of their silver plan, and that's the cost sharing. So basically it reduces the amount that you actually pay for the insurance monthly premium. So say that the insurance plan is $600 and the government is going to help with cost sharing of $599. So that means that you will only pay $1 for that plan. Of course, if you are eligible, you have to meet income requirements for the cost sharing, which is only applies to the silver plan. A simple definition, cost sharing is the reduction in your monthly premium. The government pays a portion, you pay a portion. If you're eligible, the government will pay a very large portion, and your portion may even be $0 per month. There are 2 key things to know about the cost sharing. Key number 1 is that it is for people that is below the federal poverty level. So that's who's eligible for the cost sharing. And another thing you want to know about the cost sharing is that it applies to the silver plans, okay? And another thing, cost sharing is also known as subsidy, okay? So that's what you need to know about cost sharing. Have you ever been really sick and had to go to urgent care, maybe the ER, or maybe even your doctor's office? You're feeling really ill, you're at the counter, you give them your insurance card, and they say today's bill is $200. And you're like, $200? I have insurance. It may be because you have a deductible. So what is a deductible? A deductible is the amount that you have to pay before the insurance starts paying. So say you have a high deductible of $7,000, $8,000, even $10,000. That means that you have to pay that amount before the insurance actually pays. A high deductible may be great for someone that is very healthy. Now with a high deductible, the plans are usually a lot cheaper because you have to pay before the insurance actually pays. So that's a deductible, the amount that you pay before the insurance pays. Alright, so the next terminology is enrollment period. Now the fancy name for Obamacare period is open enrollment. This year open enrollment is from November 1st to January 15, 2022. Now the open enrollment period just means that this is the time for you to apply for insurance without having a life-changing event. Life-changing event can be something like you lost your job or whatever the case may be. Everyone can apply. This is the time where everyone can enroll for insurance. Like I said, the open enrollment period for Obamacare this year is November 1st to January 15, 2022. Essential health benefits. So these are the 10 benefits that must be included to be classified as Obamacare. I have to write it down because there are actually 10 essential benefits. So let's go over the 10. So we have your ambulatory patient services. Those are your outpatient services, okay? You have your emergency services, your inpatient hospitalization, maternity and newborn care. So of course that also includes breastfeeding services as well to assist with that. Your mental health and substance abuse services. You have your prescription drug coverage. You have your rehab services, such as say you needed to see a physical therapist. You have your laboratory services, such as if your doctor wrote a script for you to get any blood work done. You have your preventative care and chronic disease management. So your preventative care would be things like getting vaccinations and things like that. And that is included. So these are the things that you usually don't pay for because insurance companies want you to get preventative care to prevent certain diseases. And you also have your pediatric oral and dental services for children, so that way your kids can go see the dentist. So those are the 10 essential benefits that must be included in the plans to be classified as Obamacare. HMO versus a PPO. HMO versus PPO. Let's start with HMO. So HMO is Health Maintenance Organization. So when you're on a HMO plan, you have to stay within a network of doctors. So basically the insurance company, insurance policy will have a list of physicians and facilities, clinics, etc. And you have to stay within that list so you can see physicians in that list, okay? So that's your in-network, also known as your HMO. So you stay within that community of doctors, and those are the doctors that you can see. So that's an HMO, okay? Also within HMO, you have to have a referral to go see a specialist, okay? So your primary physician will give you a referral to see a specialist. So you need a referral with an HMO. What is a PPO? A PPO is a preferred provider organization, okay? So a PPO plan would be a little more expensive than an HMO. With a PPO, you can go to doctors without a referral, okay? Like I said, with an HMO, you need a referral from your physician, from your primary care physician. With a PPO, you do not have to have a referral to go see a specialist, okay? So with a PPO, you have a broader network of choices. With an HMO, you are limited. You have to stay within that list that the insurance company provides. Let's talk about the monthly premium. So a premium is the monthly amount that you pay every month for your insurance plan. So with Obamacare, your premium can be less than $10 a month if you qualify for the cost sharing, okay? So the premium just means it's the monthly amount that you pay for your insurance every single month. So the next definition is a referral. Some people don't like this terminology. Some people don't like the word referral, but it exists and we need to talk about it. So of course, you already know if you have an HMO, you need a referral. So what does that mean? So that means that you must first get an appointment with your primary care physician, and your physician will actually do the referral. So the physician gives you a referral to go see a specialist. For example, say you're not feeling well, your stomach hurts. So you go see your primary care physicians, right? So basically you're giving him the opportunity to fix the problem with your stomach. If he cannot fix it, then he will send you a referral to see a specialist that deals with stomach issues. All right, so what is subsidy? So we basically already talked about subsidy when we talked about cost sharing. So basically, cost sharing and subsidy means the same exact thing. If you qualify for a subsidy, then the government will help you with the cost sharing, where the government will pay a portion. So basically, that is a fancy word for cost sharing is subsidy. Subsidy helps with the cost of your insurance if you qualify. The subsidy is provided by the federal government. So the last definition in this video is your max out of pocket. So what does max out of pocket mean? I feel like a lot of my clients get a little confused with this word, but it's very simple to understand. So your max out of pocket is not what you have to pay, because some people are like, wait a minute, I have to pay this? No, your max out of pocket is the max that you will pay for your insurance for that year. Let's give an example. Say you have a max out of pocket of $4,000. What does that max out of pocket include? So that includes your co-pays, your co-insurance, your deductibles. What does the max out of pocket does not include? It does not include your monthly premiums. It does not include your drug costs, your prescriptions, and things like that. It does not include that. It includes what you pay for your actual health. Like I said, co-pays, co-insurance, and deductibles, and it does not include your monthly premium, and it does not include what you pay for your drugs. Once you meet that max amount, say the max is $4,000, so say that year you spent a lot of money on co-insurance, co-pays, deductibles, and other things that you pay for your health. If you actually, paid $4,000 worth of that, well, guess what? You don't have to pay anything else for that year. So if you end up in a hospital or anything like that, the insurance will 100% pay the remaining of all the bills because you reach your max. And your max starts over every single year. So the max out of pocket is an annual limit. So once that year is over, then your max out of pocket starts over. So this is the poverty level chart for Obamacare, the income limits, to see if you are eligible for Obamacare for 2022. I don't think this is something that you need to memorize because these charts are constantly changing. So once your insurance broker plugs in your numbers, it's going to say what you're eligible for. But it's nice to know what the chart looked like. So this is the chart. no income, now you are going to be recommended to go ahead and apply for Medicaid, because with Obamacare you do have to have actual income, but the income determines if you're eligible for a subsidy, which is the cost sharing. So that is the end of this video. I hope you guys learned a lot today. You can make a lot wiser decisions about your insurance just by learning the basic terminology. Now you know how much you would pay for your co-payments, what are your deductibles, what's the max out of pocket, what subsidy, do you qualify for subsidy? Those are the things that you kind of want to know before you select an insurance plan, right? So if you need any help, any assistance, my services are 100% free. I will leave my number right here. You can contact me. Hope to hear from you soon. Definitely subscribe to the channel, because this channel is all about educating you guys on insurance, Medicare, and life insurance. Thank you so much for watching. I'll see you on the next video. Bye.